Like a rising tide, antimicrobial resistance, if unchecked, will threaten a cornerstone of modern-day medicine. Years of inattention to the challenge of overuse and misuse of these life-saving drugs have now diminished their effectiveness. New classes of antibiotics have not kept pace with drug-resistant infections. Growing antimicrobial resistance, or AMR, threatens our ability to treat common conditions, and increasing AMR exacts a significant human and economic toll. Our current system of discovering, developing, and making antibiotics accessible has fallen short. AMR is a global challenge. Nearly 1.3 million deaths are attributable to bacterial antimicrobial resistance, more than HIV/AIDS, breast cancer, or malaria. AMR exists everywhere. Bacteria do not recognize borders. However, we're increasingly seeing disproportionate impacts of drug resistance in low and middle-income countries and among vulnerable populations. Particularly in these resource-limited settings, access to these life-saving drugs remains a huge challenge as well. For years, governments have provided incentives for drug companies to participate in antibiotic R&D. These incentives, however, have not yielded treatments for the infections we're most concerned about, but instead just turned out drugs that were low-hanging fruit for companies. The World Health Organization found most antibiotics in the clinical pipeline were not innovative, and fewer than half addressed the more serious gram-negative infections. Small drug companies are doing most of the work discovering and developing novel antibiotics in the early stages, but face many challenges causing many of them to drop out, even before their innovations are tested on humans. Governments have played an outsized role in trying to overcome these early scientific bottlenecks, investing hundreds of millions of dollars in the discovery and development of new antibiotics. Governments are being asked to pay twice, once up front for the risky R&D, and again to have these antibiotics delivered the last mile to market. Instead of investing to overcome these early scientific bottlenecks, large pharmaceutical companies are focused on the end of the pipeline. Companies are too often developing me-too or copycat versions of prior drugs, or acquiring smaller antibiotic developers. Most recently approved antibiotics are derived from classes of drugs where drug resistance already exists, making these new drugs unlikely to be effective against resistant bacteria. With governments underwriting both R&D investment as well as market access, how can we ensure fair returns on this public investment? For the past several decades, the traditional business model for drug development has not reliably delivered the antibiotics we need today to treat resistant infections. Under the traditional pharma model of bringing new antibiotics to market, the biology and the economics are at odds. The more antibiotics a drug company sells, the more returns and profits it makes. This leads to excessive use of antibiotics, increasing the risk of further antibiotic resistance. Pharma has succeeded in calling for more incentives to uphold this failing traditional model. In the United States, industry has successfully lobbied for additional years of monopoly price protection, barring entry of more affordable options for longer periods of time. This has been coupled with high launch prices for antibiotics of uncertain or limited benefit. Understandably, these drugs are not being adopted by doctors as part of their practice. So how do we make sure that we get antimicrobials that are truly novel and effective? Our tax dollars need to create new models for antimicrobial innovation. We should not be providing more guaranteed revenues for drugs of uncertain or limited benefit. Selling more antibiotics for higher revenues would drive greater drug resistance, and this must be separated from how drug companies finance R&D investment. Failing to develop a more effective way of bringing antibiotics affordably to market robs resources that might otherwise be spent on other much-needed and cost-effective approaches to tackling AMR, from improving water, sanitation, and hygiene measures to vaccinating children. Besides effective stewardship to preserve the antibiotics we have now, we also need more public investment to overcome scientific bottlenecks during the early discovery and development phases of novel antibiotics. We must move beyond just a drug-by-drug, company-by-company approach to supporting a more effective innovation ecosystem. One way this could be achieved is through a model driven by the public sector or through a nonprofit. Health systems, governments, nonprofits, and consumers could come together and set the demand for antimicrobials by manufacturing the drug supply as needed. The drugs would be produced at close to what it costs to manufacture and deliver them, ensuring that antibiotics are affordable and accessible. This would help address shortages that threaten accessibility to life-saving drugs, even of common, older antibiotics in our healthcare delivery system. By aligning supply and demand, maximizing sales would no longer be needed. Less volume means less drug resistance. We can take a new path forward to address the global challenge of antimicrobial resistance. We must work towards a future where there is access to and not excess use of these life-saving drugs, where novel drugs emerging from the pipeline are effective, and where these drugs are affordable for patients.